Good to be with you guys. Thanks for having me.
Good morning, Dr. Fauci. Angie here. And look, there's a lot of misinformation, mistrust regarding the vaccine as rates have slowed up for people getting vaccinated, but the Delta variant is ramping up. So the first question I want to ask you is what is the administration planning to do to try to encourage more people to take the vaccine?
Well, we've got to and are doing that in the sense of getting out into the community and using trusted messengers and doing things like you and I are doing right now, getting out, talking about it, trying to reach people at the community level, the people who really need to get more information, to try and get them the information that they need to be able to make a decision. A lot of people have valid questions. They want to learn more about it. We've got to make sure we get the proper information to them, and it's best to do that by getting it through trusted messengers, people in the community that they trust, whoever that may be. It could be a clergyman, a family physician, a trusted person, people that are their peers, that they understand and can relate to.
Now, it's hard to be a trusted, we're here, we're like trusted voices, but it's even hard for us to go out into the community and be trusted voices when the CDC is constantly changing up, the markers, right? So on one end, we want to say trust the science. And 1 minute, like early in June, I was saying, hey, if you're vaccinated, you don't have to wear the mask indoors. Now we're saying, okay, even if you're vaccinated, put the mask on indoors. That further makes our audience say, well, see, no one knows what they're talking about. What do you say to that as a trusted person?
Oh, good. Well, I'm glad you brought that up. And here's where you can help by giving me and others the opportunity to explain what's happened. The science hasn't changed. The CDC hasn't flip-flopped. What has changed is the virus. Because back a few months ago, when the CDC said, if you're vaccinated, you don't need to wear a mask indoors or outdoors, we were dealing with a virus that's called the Alpha variant. It's a virus that's a formidable virus, but it doesn't spread as readily as this new virus, this Delta virus, which has now emerged and completely taken over as the dominant strain. This virus spreads much, much more readily than the Alpha variant. And sometimes when people who are vaccinated wind up getting a breakthrough infection, and that just happens because no vaccine is 100% effective. But what we've learned that in the unusual and rare situation where a person who's vaccinated gets a breakthrough infection, what we did not know before, but what we do know now with this new variant, this Delta variant, is that these people can actually spread the infection to other people. And the reason we want people now, when they're indoors, to wear masks when they're in an indoor public setting, we don't want them, as unusual as it may be, to get infected and then inadvertently and innocently spread it, for example, to members of their family. Maybe you have someone at home that's elderly or that has an underlying condition that makes them more susceptible to a severe outcome. So it isn't science that's flip-flopping. It's the virus that's evolving. And we're dealing with a really bad virus now, where the virus we had a few months ago was not as bad as the one that we're dealing with now.
So, Dr. Fauci, I know about 5 personal friends who are vaccinated, and they all have caught COVID within the past month. So do you feel like some of this is to blame for the CDC telling vaccinated people that it was okay to take their mask off, even though I understand what you're saying about the virus changing? Do you think if they still would have had their mask on and it would have been within the guidelines that it wouldn't have even got this bad?
Yes. I mean, you could always analyze things in retrospect, but back then, at the time that the CDC was saying that it's okay for you not to wear a mask when you were indoors, the Delta variant was like 1% of the variants that were out there. You know what it is now?
What?
It's close to 90%. So it's really changed dramatically. But back then, that was a situation where the Delta variant was very, very low.
So it kind of is you guys' fault.
So listen, Dr. Fauci, you're working at a federal level, and what you see from state to state is different governors and governing bodies saying different things, over the people that they govern, right? Why can't we just have a overall narrative as to what to do? Because people are hearing different things out of different governors from different states, and they're just kind of throwing caution to the wind and just freestyling. And I feel like that's one of the things that's kind of keeping us in the space that we're in right now. Texas being one of the biggest, perpetrators of this issue as well.
You do have a point there. One of the really good things about our country, the way it was put together by the founding fathers, is that you have a lot of discretion on the part of the states to do things the way they want to do it, which really reflects the divergence of our country, geographically, culturally, or what have you. However, you're absolutely right. When you're dealing with a public health issue in which the common enemy is the virus, you really got to do things in a somewhat uniform way. You can't be doing things haphazard one way, one place, one way, another place. So I can't argue with the point you're making. We should all be doing things with a common approach that we're dealing with an enemy that we really got to address in a uniform way. And what we've had in this country, unfortunately, is a lot of divisiveness where people are not doing things, maybe even on political grounds. I mean, it's no secret that in certain parts of the country that the level of vaccination is very low that coincides with people's political ideology. Mm-hmm. We shouldn't be having that. When you're dealing with a public health issue, you should do things according to public health principles, not according to political ideology.
Dr. Fauci, I want to circle this back to our listeners who are listening who have yet to get vaccinated. We've heard all kinds of reasons why. One of the big things that I hear is a lot of people saying, "Oh, I'm not getting vaccinated until it's FDA approved." And I did hear somewhere that there could be an FDA approval in the near future for these vaccines. Can you speak to some of the myths that cause hesitance among our population? That one in particular is like a big one I always see. It's not FDA approved. Yes. What do you say to that?
Yeah, well, the FDA has a very meticulous process to get so-called full approval. Right now, the vaccines, and literally hundreds of millions of doses of the vaccines, have been distributed under an emergency use authorization. The data as to the effectiveness and the safety is overwhelmingly positive. Yet, the time for the FDA to dot the I's and cross the T's makes people say, well, why don't we have full approval? It really has nothing to do with the safety and the efficacy. It really has to do with the process that's involved. And I understand it's a process that everybody's impatient with. Mm-hmm. I would hope that as we get into August in the next few weeks, that we do see the full approval, because you're right. When that occurs, people are going to feel more comfortable. But I can tell you right now, the amount of data that we have that this is a highly effective and safe vaccine, there's no I would be astounded if these vaccines are not approved fully by the FDA.
Now, Dr. Fauci, I know you got to run, but in closing, if you were us, would you be attending festivals? Would you be going on public gatherings? Is now the time to be doing these things?
Well, right now, if I were in an area, I'm in an area that's got low level infection. If I were in what they call the orange and red zones, where there's a high level of infection, even though I'm vaccinated, if I were doing things indoors in an indoor public place, I would either avoid it or wear a mask if I did, even though I'm vaccinated.
Okay, and last but not least, do you see us shutting down again? Because that's a rumor that I see a lot of people saying that, like, we might have to go back into quarantine, all of us.
I do not see us shutting down. I see that if we get more people vaccinated, we keep going every single day, getting more and more people vaccinated, we can get our arms around this and really shut it down. The solution to all of this is get vaccinated. So if we do that, I don't see us shutting down at all.
Did you take Pfizer or Moderna?
Moderna.
Okay. That's what I'm going to take then, because I'm trusting you with what you're saying.
They're both good. They're both good.
Okay.
J&J? J&J, Johnson & Johnson?
Yeah, they're all good. They're all high.
Nah, I didn't name that one, okay? I didn't name that for a reason.
There it is. Yo, Dr. Fauci, thank you so much for the intel and the information, brother.
Thank you very much. Good to be with you.
Much love, man. Peace.
We are the Morning Hustle.